At the age of 12, I developed a very serious physical medical condition called femoral capital slip epiphysis. It's basically a condition where the joint of the hip gets dislocated, and in my particular situation, it nearly pinched off both femoral arteries. And it required very major surgery. The surgery was so complex that it couldn't even be conducted in the hospitals in South Bend, Indiana, where I live. So I ended up in a Chicago hospital. And after the surgery, I did not have the opportunity to go back to my regular elementary school because schools weren't accessible. I was using crutches and a wheelchair. I remember being at home, and I couldn't take a bus, so the school system would have a cab come to my house and take me by cab to the school. And I'd look out the living room window. Back then, homes had picture windows in the front. And I'd see a group of kids standing on the corner taking the bus that I would have taken to go to the elementary school, and they're all talking and interacting. And I lost all my relationships with kids because I wasn't part of that group anymore. I wasn't integrated, I was segregated. And up until that time, I had attended, probably from the age of 7, a YMCA camp in southern Michigan, and I loved going to that camp, and I couldn't go back to the camp because of my physical condition. So my parents sent me to a deviancy camp, a camp called Camp Millhouse. And oh my gosh, I just hated it. I mean, they had things there that I enjoyed doing, but the camp itself had all these kids who were in the latter stages of muscular dystrophy and that they couldn't breathe. I remember sitting across from this one girl who had been through a horrible fire and her ears were burned off, and I didn't see myself as any of those kids. So by the time I was in high school, I could go to a regular high school. There wasn't any residual effect physically with regard to my condition. And between my junior and senior year, I had to get a job during the summer. My parents didn't really have any money to send me to college. And I was looking for a job. And I just couldn't find a job. And so I thought, well, what about contacting Camp Millhouse and becoming a counselor? I can never feel the pain that the vast majority of all the people in our system feel because their conditions are lifelong, far more severe than what I experienced. But I know for that short period of time that I was challenged physically the way I was. I know how I felt about being removed from society and how people related to me when I was even using a wheelchair, you know, how they'd have these grins on their faces that they wouldn't have had before I used it, or they would alter their vocal tone, or somebody would come up and pat me on the leg. And I think it's that you know, sort of generates my enthusiasm, as well as this thing that's in my head. And I call it GEM, and it's an acronym, and it stands for Good Enough for Me. And what I have forced myself to do over the years, and I encourage others to do, is that when I look at the people who we support, I do not see them, I see me. So that's me who has excessive saliva coming down my face, and no one will give me a runner's wristband to keep my mouth dry. No one will ask the physician whether I should have a scopolamine patch. It's medication of the Dramamine family to help dry me up. And no one will ask the physician whether I should have ophthalmic atropine, QID, 4 times a day, a drop under the tongue to help dry me up. I got to spend the rest of my life with saliva coming down the side of my face. And I can go, you know, thing over thing, you know, that's me who has contractures and I can't reach the brake handles on my wheelchair, and no one will give me brake extensions that allow me to do that. When we change the way in which we see things, the things we see will change. And it's really a matter of changing how we see things that will alter our relationships with other people. If I see me when I look at you, I will hopefully then treat you differently than if I see somebody other than myself. Now, we have a name for that. That's called empathy. Empathy is treating others the way you would treat yourself. A couple points to be made. I think we need to do something more than empathy. I think it's not a matter of treating others the way you would treat yourself, but rather treat others the way you would treat yourself under the most challenging of circumstances. How would you treat yourself under the most challenging of circumstances? And there's also a warning that goes with this, because if we as individuals do not treat ourselves as good and valued human beings, if we allow others to mistreat us, don't be empathetic. That's dangerous. Don't use GEM, Good Enough for Me. So it requires that we as individuals treat ourselves as good and valued people. It requires that we don't allow ourselves to be mistreated, that we put boundaries around ourselves. That then gives us a foundation to treat others with dignity and respect, because that's the way that we would wish to be treated. My challenge and my struggle is, how can we get other people to believe that an individual who has profound intellectual challenges, can hardly move, doesn't even know they've gone someplace after they've gotten back, cannot tell you their name? How can we support them in giving and doing for others? How can we give them meaning and purpose in their life? That is what we need to do. That's what that's about. Because I want them to be seen, that person needs to be seen differently in the eyes of others. They need to be seen as a contributor,